This short video is an introduction to military medical ethics. I am Professor Martin Brickenall, the Professor of Conflict Health and Military Medicine at King's College London, and I was, until April 2019, the Surgeon General of the UK Armed Forces. So this short video will introduce the ways in which it's possible to think about answering the types of questions that are put up on this slide. Who should be picked up by medical evacuation helicopters? Should I train my medics to operate crew-served machine guns? Should I withdraw treatment from a child burned in a cooking accident to free up an intensive care bed for a military patient in a field hospital? Should I declare a soldier unfit to deploy because she refuses to take antimalarials? Should I order a doctor to treat infectious disease patients? Should I tell the commanding officer of a soldier who has declared his addiction to alcohol? Should I downgrade a senior non-commissioned officer whose medical condition precludes deployment and prevent their promotion? Should I administer a vaccine that I think is unnecessary? This video won't provide the answers to all these questions, but what it will do is introduce you to various frameworks around which answers for these questions can be found. So what we'll do in the video is introduce the subject of military medical ethics by considering the fusion of medical ethics, military ethics into military medical ethics. And as a colleague of mine, Commodore Rich Withnail, wrote in this paper in British Medical Journal Military Health, Military Ethics and Operational Priority, he argues that it's vital that healthcare workers working in the armed forces fully understand their ethics and their responsibilities towards their patients and their professions. So medical ethics is underpinned by the principle of first, do no harm. And this is founded upon the four principles of autonomy, the personal right of control over decisions about their health, including consent for patients, beneficence, a person's right to the benefits of intervention to improve their health, a null masifience, they mustn't be subject to interventions that could cause harm. And finally, justice, that's fairness in the allocation of resources, both at the individual patient level and also at the population level. And the Code of Practice for Healthcare Workers is published by the World Medical Association as an international code of medical ethics. And it covers the duties of physicians in regard to their practice in medicine, their duties to their patients, and their duties to their colleagues. Medical ethics is supported by a number of resources. But at the international level, the World Medical Association publishes an ethics manual and some very detailed guidance on the fundamentals of medical ethics. A number of other international bodies, for instance, the World Health Organization, publish some internationally agreed principles and foundations for the ethical practice of healthcare. At a national level, the regulatory bodies in the UK, the General Medical Council, the Nursing and Midwifery Council, and the Health Professions Council essentially regulate the professional practice of doctors, nurses, and professions allied to medicine. And the website for the General Medical Council is shown here with a range of supporting material on ethical guidance for doctors. Beyond that, professional associations, such as the British Medical Association, provide some further guidance on ethical practice in regard to particular areas. The final resources are academic resources, where the discussions around ethical principles can be followed. And the website shows the UK Centre for Clinical Ethics Network. The military ethics is underpinned by the principles of the laws of armed conflict, based on two discrete phases. Firstly, the law applied to going to war, jus ad bellum, which is a legal basis by which states might use their armed forces to essentially create violence. That's covered under national law and international law and the UN Charter. And then once committed to warfare, then the armed forces should follow the law in war, essentially based around the military necessity to use force, and the flip side, which is humanity, which is obviously to minimize the consequences of the use of force. the principle of distinction between combatants and civilians or non-military actors. And finally, the principle of proportionality, to use enough violence to achieve the purpose, but no more. Essentially, this is covered in the laws of armed conflict and international humanitarian law, founded upon the Geneva Convention and additional protocols. Beyond the conduct of war itself, the practice of the profession of military is covered by other legal and ethical frameworks. I've touched on law and war, shown on the graphic from the ICRC website, but also there is the ethics and law of the status of the armed forces in society, conduct in war, and then in garrison, and how the armed forces conduct themselves when not deployed. And this is particularly covered in documents such as values and standards documents, setting out the behaviours expected of those people who wear military uniform. So fusing the two is military medical ethics. And this is described as a dual loyalty. The loyalty, the profession of healthcare, and the professional loyalty towards the profession of military practice. And for healthcare professionals, one would expect that the ethics of their profession as a healthcare professional take precedence over any duties under military law. And indeed, of course, you can leave military employment just by changing employer. But if you committed an offence that led to a sanction from your professional body, of course you could be struck off and therefore unable to practice the profession for which you had been trained. So just picking up on military medical ethics and various sources of guidance, probably the most important guidance is the document shown on the slide, The Ethical Principles of Healthcare in Times of Armed Conflict and Other Emergencies. This has been put together by a number of international bodies, including the World Medical Association and the International Committee of the Red Cross, and signed up to by the International Committee of Military Medicine. And this sets out the ethical principles for healthcare professionals during times of armed conflict and other emergencies, including the general principles shown on the slide here. In summary, the ethical principles of healthcare do not change in times of armed conflict and other emergencies, and that healthcare personnel should at all times act in accordance with the relevant international and national law, ethical principles, and their conscience. And the primary task of healthcare personnel is to preserve human and physical and mental health, to alleviate suffering without discrimination of any kind, respecting the dignity of patients, and that the privileges and facilities afforded to healthcare personnel in times of armed conflict should not be used for any other purpose. And finally, no matter what arguments may be put forward, healthcare personnel should never accept acts of torture or any other form of cruel, inhumane or degrading treatment under any circumstances, and they must never be present or never take part in such acts. In garrison healthcare, there are issues associated with the practice of medicine in the military environment. Perhaps the first is consent, where there's definitely a power differential between the healthcare worker and the patient, often compounded by rank. And so it's important to ensure that consent is truly informed consent. This extends to confidentiality and the reporting of medical fitness for work codified by medical grading. And this is really covered by ethics in occupational health practice, and where the commanding officer has a right to know the physical and mental capacity of a soldier, sailor or airman under their command, but not to know the medical details. In force health protection, then there are some important issues about consent for immunization and other preventive measures, which are applied at the population level, but obviously administered at an individual level. There are aspects to do with mental health, particularly in terms of sectioning, alcoholism and drugs abuse that are unique to the armed forces. And finally, there are aspects of forensic medicine and the role of medical advice and supportive investigation of crime that are important to consider. Beyond those two generic environments, there are some special circumstances. The first is research, where informed consent is particularly important, especially for research programs that would be classified or certainly outwit the public domain. Those people involved in health policy need to be very sensitive to ethical issues when they are framing policy that apply to the whole of the armed forces. When one is considering information for intelligence purposes covering medical capabilities, then there are some fine boundaries between utilizing scientific knowledge for the benefit of protecting patients versus the utilization of scientific knowledge to aid combat power. I touched on earlier in the ethics of medical ethics in military operations, some very particular issues around providing medical care for detained and captured persons. I've shown on the slide two reference sources. The first is the chapter on military law and ethics in the US textbook of military medicine, and that covers the application of this boundary that I've said between military law and medical ethics. And from a UK perspective, the British Medical Association has published a toolkit for ethical decision making for doctors in the armed forces. So what I hope I've managed to do with this short video is introduce the subject of military medical ethics by considering the fusion of medical ethics and military ethics into military medical ethics. I've definitely not covered the breadth of the subject by any manner of means. And here's a list of resources that would be valuable if you are looking for further information. I've touched on the World Health Organization, World Medical Association, and I come from the King's College Centre for Military Ethics, where there are learning resources both in military ethics and also military medical ethics. There are two other international centres that have information on military medical ethics shown here on the slide as well. So hopefully that was useful, and if you want to find further information on military medical ethics, then the King's College Centre for Military Ethics has additional resources available from the website. Thank you very much indeed.